Hey, Dan from Jump Bag here, back with another round of our acronym series for the acronyms and terms that you need to know for National Registry and your EMS career. And today, DCAP BTLS. What is it? I'm glad you asked. This is what we're going to use to identify what's wrong with a patient during our trauma assessment, giving us ideas of what we're looking for. So let's get after it. DCAP BTLS, deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. Let's break it down just a little bit further. Deformities, this is going to be anything that's misshapen, when the arm isn't the same shape that it should be, or there's a lump in the body that shouldn't be there. Contusions, we're looking at bruising and discoloration. Abrasions, it's when that top layer of skin has been peeled off and there's an abrasion there, like when you were a kid and you fell off your bike. Punctures, this is anything that has broken the skin or maybe made entry, like a penetrating trauma of some kind. Burns, this is where first, second, third degree, right? We remove that top layer of skin or maybe even further, and we're allowing the outside world in and the inside world out. Not good. Tenderness, if the person is in pain wherever you touch, that's not supposed to be happening. It's not supposed to hurt upon touch. That's an indication of an injury. Lacerations, this is anywhere where the skin has been broken and the inside world has now been exposed to the outside world. Their body is exposed to the environment. And last, swelling. Swelling is going to be an indicator of healing or trauma. The body's flooding that area with blood and white blood cells and platelets, everything it needs to do to create that healing and protect that area. So here it is, DCAP BTLS. Learn it early and just repeat it. If you get tired of saying it, you're probably doing it right. You're going to need to know it on your trauma assessments and National Registry and out in the field. Thanks for watching, and we'll see you next time.